Every 3 minutes, one person dies from traumatic injury. 5.8 million people die each year as a result of injuries. This is 32% more than deaths caused by malaria, HIV/AIDS, and tuberculosis combined, according to the World Health Organization. Many of these people are victims of road crashes. And because they are so severely injured, many of them die due to poor care within the first hour after they are wounded. But we can all do something about it. TraumaCare International Foundation was established on the 5th of January 2012 as a registered non-governmental organization with the vision to improve the state of trauma care and emergency response services in Nigeria and its other member nations through health education, advocacy, and community-based programs. With trauma becoming increasingly a global public health problem, and studies reporting that over 4 million people were at risk of injury and that as many as 200,000 potential deaths may occur due to road traffic crashes in Nigeria, we recognized a heightened need for improved knowledge of a pre-hospital emergency response, appropriate access to care for trauma victims, increased acceptance of voluntary blood donation, improved casualty management and evacuation among first responders, and capacity building for healthcare professionals.
I remember in year 2000, I want to just tell you a life scenario, what really happened then. I was on patrol as a young officer then, and a truck beat my patrol team, and just not quite 5 minutes thereafter, a light-eyes vehicle, a bus, about 14-passenger bus, did exactly the same, beat the patrol point. Not quite 10 minutes thereafter, my patrol team was called upon to rescue some victims. To our dismay then, we discovered that it was the truck, the tanker rather, that beat the patrol team then. Both of them met at a cliff of a hill, and it resulted to a crash. Two people were flown out of the bus, the rest got bumped. This is where you discover that Nigerians are willing to help at all times as a crash. But doing the right thing at the crash scene is another thing. The training today, conducted by TraumaCare International Foundation, is a collaboration that spells good for FRS